Let's pretend these are biohazard cookies from our client while we are tattooing. So in this way, it's easier to visualize how our station can actually have cross-contamination. So like this, you think I can touch my face? How about open the door? Nope. I cannot go for more ink. It's quite disgusting, honestly. And there are two steps we always need to follow before setting up our workstation. And a mistake that I look very often is that some people. Hello and welcome to the second class of the Koski Academy. Today we are going to learn how to properly set up a tattoo workstation in a clean and aseptic environment. Before we start, I will always recommend that anyone that is interested in tattooing completes a bloodborne and pathogen certificate. This class is a practical demonstration, but safety education should always be part of your professional foundation. And this topic is extremely important because people that works with waste, sharp objects, or contaminated materials face a high risk of injury and infection. Studies shows that at least 47% of people that works in this kind of environments face at least one injury in their careers, and many of those incidents leads to bacterial or viral infection. That's why in this class, I'll show you the most common risk of tattooing, how pathogens are transmitted, and the habits and protocols you should follow to reduce this risk as much as possible. My name is Moises. I've been tattooing for over 10 years, and you can find my work in social media as Moikoski. And before we talk about how infections spreads, it's important to know which pathogens we are trying to protect ourselves and also our clients. Some of these common pathogens include hepatitis B, hepatitis C, HIV. There are also common bacteria like Staphylococcus. Of course, the list is much bigger, but instead of talking about any single of them, in this class, I'm gonna show you how to prevent the cross-contamination in a real tattoo environment. So let's begin understanding the different ways that infections can spread in a tattoo environment. There are four main types of pathogens transmission. The first one is bloodborne transmission. These pathogens spread through contact with infected blood, entering the body through cuts or mucous membranes. And this is probably the most important risk that we face because we are working directly with needles and skin. The second type is the airborne transmission. These pathogens travel in small particles in the air, especially when people cough, sneeze, or even talk closely. The third type is the waterborne transmission. These infections can spread through contaminated water or liquids. And the fourth type is the contact transmission through the skin or contaminated surfaces. That's why learning how to prepare your workstation properly is one of the best skills that you can develop as a tattoo artist. And there are two steps we always need to follow before setting up our workstation. And the first one is to take off our shoes in the entrance because we don't want to bring any dirty from the outside to the workstation. And the second and probably most important one, before doing the setup, always wash your hands. And do it for at least 30 seconds in between your fingers, in beneath your nails, till the wrist. Even when we are using gloves, it's part of the protocols that we need to wash our hands before manipulating anything on the workstation. Now that we wash our hands and wear gloves, we can start with the setup. Remember that for a tattoo, the garbage is one single use. After every client, we need to throw the garbage, so at the very beginning of your setup, you will have your garbage empty. That's why the first step is to get a new bag for the garbage. Now we need to make sure everything is clean. And for that, normally people use Cabi wipes, but I'm gonna leave you here any other product that they also works. Remember, for the wipes, you can use both faces of the paper towel. So you can use one side for the bed and then flip it, and the other side for the table. Of course, if you are gonna use a pillow, you can also clean it. Same if you are gonna use an arm resting. And I will recommend you to clean every single surface that you are gonna touch during the tattoo. I hope this is common sense, but remember that in your workstation, they cannot be food or personal objects. Now we are going to start using the barriers. So every object that is not disposable, such as the bed, the table, the pillow, is gonna be covered with plastic, so there's no direct contact with blood, skin, or anything. But even when we are gonna cover it, remember that all the objects needs to be on a surface that is easy to clean, such as leather or steel. It cannot be of fabric or cotton or something that can get dirty easily. Now let's start covering the table. Always make sure you're going to cover the 100% of the table. It is a very typical mistake that some tattoo artists, they are just gonna cover the place that they are gonna place their ink or machine, but the risk of splashes or cross-contamination is always there. So we are going to protect ourselves and our clients better when we cover the 100% of the surface. Now, this is not 100% needed, but having a dental bib, it helps you to get an easier surface to work with because it's not gonna get sticky to the plastic. Now, following the same logic, in case we need to use the bed, we are gonna cover the 100% of the bed. And very important, try to cover as much as you can of the borders, because this is where most of the tattoo artists fail and sometimes can lead to some cross-contamination. Again, this is not 100% needed, but sometimes the plastic can be too sticky with the skin, so a dental bib will help our clients to be more comfortable. And remember, tattoo is not just about being safe, but also being professional, and having a comfortable environment for our clients is very valuable. Now, every single surface that you will need to manipulate during the tattoo, such as the armresting, the iPad, if your client needs a chair, if you need to manipulate the light, you will need to cover it with plastic. After we have everything covered, now it comes the moment that we will all be waiting for, how to set up our supplies here. So let's start with the machine. I'm gonna show you how to prepare a cordless machine. If you're gonna use any other kind of machine, it's basically the same. Just remember that you will also need to cover the cord as well. So the first step is gonna be to cover the grip with plastic. And for that, we are gonna use these barrier films. These ones are very useful because they are gonna seal all the entrance to the needle. And over this, we can use a plastic bag to cover the rest of the machine. Now, for having a better grip, we are gonna cover the grip with grip tape. I see many people using this as a barrier, but remember, this doesn't avoid the blood to go through. So that's why we always need to use the plastic. And I've also seen many people leave the bag of the machine open. I like to grab just a piece of tape and leaving it completely sealed. Now the needle or needles that we will use, remember always check that it didn't expire yet. And normally with the same needle, I like to poke the plastic here. So now my machine is ready to work. Always remember, this garbage, we don't need it in our station, so this is going to garbage. Now for your squeeze bottle, remember that the water always needs to be distilled water. And the squeeze bottle needs to be washed once a week, so we make sure there's no waterborne pathogens in here. Of course, we are gonna cover it as well with plastic. And I always like to put a small piece of tape just to make sure it's sealed. Now for your ointment, I always like to use one of these wooden, I forgot the name. So I just grab as much as I will need for this session. And this same wooden, I like with a little bit of ointment on both sides. Put it here. Place a little bit of ointment on the top. And this will give me a really nice surface to place in my caps. Before pouring the ink, we are gonna check if it was previously open. If it wasn't, at the moment that we open it, we are gonna write down the date where we open it, because after we open the ink, it's gonna be good for 1 year. So always before using it, make sure it didn't expire yet, and at the same time, it didn't pass more than 1 year from the date that we open it. After we make sure of that, we can use one paper towel to put it on the tip, shake it, and now we can pour it. I always recommend don't go too low on the cap to avoid any risk of the needle touching the bottom of the cap, and that will cause either way a splash or the needle can get damaged. If that happens, I would recommend to change the needle and clean whatever is dirty. But for now, let's go with the black. And here, I wanna tell you that in case you're gonna use a gray wash, you either way use a distilled water or mixing solution. Once we have the ink in the cups, there's no need to keep the inks here. Remember, everything that is in this table, it have risk to have cross-contamination. So please remove all of this. Now you can also grab some paper towels, as many as you consider you will need. But there's no need to keep the full roll in your table. You just need to keep here the ones that you're actually going to need. And in case that you need it, you can have a cup of water. A nice trick to avoid this water to fall down is to grab another cup and cut it half. So now we have this nice support which make it almost impossible to fall. And that is pretty much all that you need to have in your station. Sometimes you can get a sponge to clean your needles, but any other supply, there's no needed to have it here. Remember that this place is in risk of cross-contamination. Even the gloves, if we need to change it, we can just pull them out and grab new ones. As you can see, it's very easy, so let's avoid any unnecessary risk. Now with the setup ready, we can start tattooing. However, you will probably first need to place the stencil or do a freehand drawing. And in this class, I don't want to get too deep into how to place a stencil, but I do want to mention some mistakes that I see very often in reels or even in tattoo shops that can cause cross-contamination. So before placing a stencil or freehand drawing, we need to prepare the skin. So for that, we are gonna clean the skin twice with sanitizer. I don't have any model with me, so I'm gonna show you just in my forearm. So basically with a paper towel and sanitizer, we are gonna clean. We are gonna give it a couple of minutes and then we are gonna clean again. After we clean, we are gonna shave the skin with a single-use razor. And I always like to clean first before shaving, because if you do it the other way around, sometimes the alcohol or the sanitizer can irritate the skin. So you are going to shave in the way that the hair grows to avoid any irritation. And remember, this is a sharp, so it goes to the sharp container. That's all the preparation that you need for the skin. So in case that you're gonna freehand over the skin, just remember that your markers are gonna be single use. Remember that one cause of cross-contamination is the contact. So we don't wanna be using the same markers with many people. Now, if you want to use a stencil, you will need to use a solution to place the stencil. And a mistake that I look very often is that some people, for pouring the stencil, they touch the tip of the bottle with the skin. Remember, there are pathogens that they are transmitted by contact. So we don't want this bottle to be touching every single person that comes to the studio. It's quite disgusting, honestly. So a better way to do it is that you're just gonna pour a little bit on your glove. And from here, you can use as much as you need on your client. And using this way, the bottle keeps clean all the time. Now, if your stencil is for friends, couples, or in general, it's a design that you're gonna do the same one in 2 or more people, remember you need one paper for each person. Because if this paper got in contact with my skin, we don't want the same paper get in contact with other people's skin. Now let's pretend these are biohazard goodies from our client while we are tattooing. So in this way, it's easier to visualize how our station can actually have cross-contamination. So this is why in our station we can just have supplies that they are properly wrapped. And I hope that also makes clear we don't need any unnecessary supply here. So like this, you think I can touch my face? How about open the door? Nope. I cannot go for more ink. It's not even recommended to walk around with your gloves. You will have high chances to get an accident walking around like this. So now we have all of this mess, and I know what you're thinking, how we can clean this properly. So to start, I like to take care of the liquids, and there's 2 ways to do it. One is that tattoo studios, they normally have a sink for contaminated liquids, so you can just pour it there. And what I like the most, with a solidifier, I just pour it and I can throw it to the garbage. So here, I'm gonna give you a demonstration. I just pour a little bit of this, and I can also add some of it for the ink. Now we just wait a little bit. So after a few seconds, as you can see, it's completely solid. So now you can throw it to the garbage. Now we need to take all the needles that we use and throw them to the sharp container. And just after that, we can start cleaning our station, taking out all the barriers that the machine have. And here's a trick that I like to use, that when I'm gonna take out the machine from here, I don't wanna grab it with the tips of my fingers because they are obviously contaminated. So I like to grab it like this, take out the plastic, and leave it on the side. Now for the squeeze bottle, I remove the tape, and I normally grab it with the pinky. In this moment that I just need to collect all of this, I like to change my gloves. So now with the new gloves, I just remove one corner. I place my machine in the squeeze bottle here, and all of this can get into a bowl that goes straight to garbage. Now we are gonna do the same with every object that we put grab on. After removing all the wraps, now it's time to clean. And remember, clean is always a two-step process. So we can change the gloves before we clean. And again, we are gonna use the cubby wipes. So remember, we can use one side to clean the machine and the other side to clean a different surface. And we will repeat the process for every single object. And as I say that cleaning is a two-step process, we are gonna do exactly the same again. Don't forget that the garbage needs to be cleaned for every single client or every different day. After that, don't forget to clean the floor. I always like to do it in the Latino way. And last but not least, we are going to remove our gloves and we are going to wash our hands again. And that's everything for this second class. Now I know you can do a setup as a professional, keeping everything aseptic and clean. And before I go, I would like to remember you that all of these protocols, they are constantly changing. So as a professional, we all need to keep updated with this. That's why the certification for bloodborne and pathogens, you need to do it at least once every 2 years. But that's everything for me. I hope you like it. If you have any questions, don't hesitate to leave it in the comments below. And I'll see you next time. Ciao!